I was hearing the same story over and over from my patients. A story about having really severe menstrual cramps and pain as teenagers or young adults, but their pain being minimized or normalized, or even when they sought help, was being dismissed. Some pain with periods can be normal, but when the pain starts interfering with your daily life, that's not normal. It became quite obvious that we really needed to reach these patients at a younger age when they were teenagers or young adults.
It was a different type of pain that I was used to feeling. I remember not knowing if this was a normal thing, but a lot of the sources out there were very sketchy, not exactly the most trustworthy.
We also wanted to make sure that we were taking them to the proper sites where they had good, reliable, evidence-based information, that they could use that information then to empower themselves to seek the help that they needed.
Periodpain.ca is an exciting new tool. It's the first of its kind in Canada that was co-designed with youth to share accurate information about period pain. Beyond co-designing the tool, our youth partners also helped us launch a social media campaign. The campaign reached 800,000 people in just a month and resulted in over 6,000 visitors to our newly built website.
At the BC Women's Centre for Pelvic Pain and Endometriosis, we educate the next generation of care providers and are doing groundbreaking research that is changing how we understand this condition. The periodpain.ca website is one of many research projects and care advances our team is working on. Through these kinds of innovations, families, including husbands, fathers, and brothers, can also better educate themselves and support their loved ones.
The team at the Women's Health Research Institute, in partnership with BC Women's Hospital, recognized that there was a very real gap in postpartum mental health support. And so what their research showed was very clear that many new parents are feeling exhausted, overwhelmed, and unsure of where to turn. So they needed support that was very easy to access, that was trustworthy, and that was specific to the resources that were actually available within their region. To develop the tool, we worked really closely with both mental health clinicians in BC from BC Women's, and then importantly with patient partners who had lived experience with postpartum mental health challenges. And then together we did co-create the digital platform for new mothers called postpartumcare.ca, making sure that it wasn't just clinically sound, but it was also practical, compassionate, and truly reflective of what patients were really needing during that time.
1 in 4 Canadian families is impacted by perinatal mental health concerns. You are not alone. Families are not alone. This research-backed project was developed to respond to those very real needs. My postpartum mental health experience took me completely by surprise. It wasn't something that I was expecting or ready for. What I thought originally was the baby blues turned into something much larger. I developed what I know now as a major anxiety. It colored everything I did. Daily life was a bit more difficult on certain days, and everyone around me was affected as well. My husband, my friends, and my family. It was a difficult and challenging time for all of us. I don't think anyone fully knew how to support me, and to be honest, I didn't fully know how to support myself. Postpartumcare.ca provides visitors access to research-based education materials, tips and tools, as well as links to BC-based resources. Now that I can speak out about it many years later, of course I want to be sort of an advocate for maternal mental health and really tell other mothers that it will get better.
eSense is a digital health tool that was really designed to close the gap in access to effective treatments for women who have sexual concerns. And given that we know sexual concerns in women are extremely prevalent, at least 1/3 of the female population suffer from ongoing sexual concerns and face real barriers in getting access to care. And so we developed eSense as a way of bringing the evidence-based treatments to women that they could access in the privacy of their own home on their own time. So unfortunately, there are lots of barriers to accessing care in women's health in general. And when it comes to accessing care in sexual health in particular, a lot of those barriers are magnified. There's still a lot of shame and stigma that prevent women from even talking to a care provider about sexual health concerns.
The barrier to care that I experienced could probably be best described as a lack of awareness on my part that care was available for what my situation was.
We've been looking at midlife women experiencing perimenopausal symptoms, and noticing that they're really benefiting from eSense. We're also doing some additional analyses among cancer survivors and finding it to be really relevant for the kinds of concerns that they experience after cancer treatment. And then a third group are trauma survivors. And sadly, 1 in 3 women across their life will have an encounter of sexualized violence. And what we're finding is eSense works just as well for them as it does for the women without a history of sexualized violence.
eSense shows what's possible when women's health research doesn't stop at publication, but is translated into care that women can actually access. Right now, eSense is transitioning from clinically validated research project into real-world care. So over the next 6 months, we'll be running a commercial pilot. So we're going to see how women are using this outside of a clinical trial setting. We're going to see how clinicians are integrating this into their practice and see how we can continue those outcomes at scale.
With more research funding, we can continue to work with youth to improve period pain care.
With continued investment in research, we can expand access and enhance tools like this and ensure that more new mothers receive the support that they need when they need it.
With more research funding, we could reduce preventable disease, enhance quality of life for women, and in turn, return benefits to our economy, because when women are healthy, all of society benefits.